The Kids Club is a community pediatric healthcare service that empowers the lives of children who are medically complex. That differs from a typical daycare because all of our children have an underlying medical diagnosis that requires some level of skilled nursing.
Every child that comes in gets a head-to-toe assessment. Each center and each room has a schedule and a routine. So we pretty much run it with an educational curriculum in mind. But from a medical standpoint, you know, the nurses are constantly assessing and reassessing, giving medications, doing treatments, contacting the doctors, the case managers, therapists, whatever it may be, to keep that child's medical record ongoing and the plan of treatment current.
I'm Robin Jones, and I've been around the Kids Club for about 12 and a half years now. Before the Kids Club, I was trying to manage him and his sibling and working 8 to 10 hours a day, and it was really, really rough. I finally got them in the Kids Club, and they were getting first steps. Tracy, his other sibling, had to cleft lip and cleft palate. They were able to take care of that situation also. So, and then Brennan was able to get therapy and everything he needed through the Kids Club also. So it was really, really great getting them in here, and a big hand.
We're looking at the development of a child and the age-appropriate developmental curriculum that is important to us, starting at the foundation. How they interact with one another, how they interact socially, their communication skills, cognition, in terms of their development. So we're really looking at how we can intentionally use the curriculum that we're writing to get the most out of the child.
The best thing about it is just seeing the kids come and be happy. They don't realize that it is a medical facility or they're getting medical treatment. They think they're coming to school or to daycare, and that's what we want them to think, because the majority of their lives they've been in and out of doctor's offices and hospitals, and so we don't want them to be fearful of coming to us thinking that they're going to get a treatment or something that's going to hurt. We want them to know that they're able to have fun and play and just happen to get treatment, you know, along the way.
They have turned me in a really good shape. I'm getting all the services that I need, and I'm still going to school. And what I really like about it is that I can catch the bus here, and if I have problems while on the bus, while here, there's nurses here to take care of me.
One of the things that I find most impressive about working with the Kids Club is the amount of diversity that is encountered when you walk through the doors. You see kids from all different backgrounds, who speak different languages, whose parents speak different languages, and the Kids Club really goes out of their way to make sure that they can accommodate anybody who comes through the doors, as long as the children get what it is that they need.
I think the most fulfilling part of this job is, you know, going into our centers and seeing the smiles on the kids' faces and knowing that you do have that connection and bond with them, and that's something that will never go away.
When I'm sitting in with a parent who perhaps speaks Spanish, and maybe they have a general idea of what the Kids Club provides, but I'm able to explain in Spanish what it is that we do and to what extent, the look of relief that comes over that person's face and the tears that come, and I usually end up crying with them, but the tears that come with it, knowing that their child is going to be taken care of and that they don't have to be super vigilant. They can actually relax a little bit, go back to work, go back to school, take care of their other children, and know that their child, who formerly maybe wasn't able to participate the way their siblings might have been able to in a daycare system, is now able to do so.
I guess I've seen children have a chance to be more than they could have been just with the parents alone help. Is that you have a group of people helping the child achieve goals. There's just been no motivator like another child that comes and steals their toy to get them up and to put the things that I've done or the fruits of my labor into action, like their peers and a group setting.
I just like coming here and going to school, basically. And when I'm at school, I'm having lots of fun, and when I get back, I'm having lots of more fun. I just really enjoy it. I just want to thank everybody and partner of this ship, and I really enjoy it. I do. I want to thank everyone for helping me get this far.
In short, we at the Kids Club know that it's difficult to put your baby into somebody else's hands. But the one thing that you can rest assured about is the fact that we want the children that come to us to thrive. We want them to supersede all expectations. We want them to get all the medical treatment that they need, but we want them to be kids and not feel any different than their siblings, than other kids that they see in the community. We let kids be kids. And I don't know how to say it any better than that.